Hi, I'm Dr. Jeff Williams, and I work at the Center for Community Health and Prevention with Chris Wille, who's a nurse practitioner, and joins us in our clinic where we work with people about understanding their cardiovascular risk so that they can make a decision about what lifestyle changes they may want to make and about whether they want to use a cholesterol-lowering medication. So we're going to talk about the discussion that doctors are asked and nurse practitioners are asked to have with all patients around their cholesterol. This is for a discussion for people that have not had a heart attack or stroke and they don't have other forms of vascular disease, which is most of the people. This discussion is recommended by our national guideline and by the American Heart Association. And you may have noticed that doctors are no longer interpreting cholesterol numbers by themselves. We're not supposed to use those numbers. We're supposed to use your whole level of risk for you to be able to make a decision about what you're going to do and for us to make a recommendation to you. This is relevant for everybody. 50% of us will have a heart attack or stroke in our lifetime, and about 30% of us will die from it. That's true worldwide. And this risk goes up over our lifetime because it actually has to do with the building up of cholesterol in the artery walls, which is over time. And at some point, risk gets high enough where it causes a problem. So what Chris and I are going to do is Chris is going to play a patient, and I'm going to have this discussion with her to demonstrate what you might expect when you went to see your doctor. Hi.
Hi.
How are you today?
I'm good. How are you?
Good. Thanks for coming in. I also saw that you went for your cholesterol labs, and that's great because now we have an update on where you are with your cholesterol, or you can make some decisions about some things that you want to do.
Very good.
And just to summarize, I know that you don't smoke.
No.
And you do have high blood pressure, but
Yes,
that's
I do.
been under control.
Under control.
Yours was 135 over 80,
Okay.
which is pretty good.
A little bit high, but
A little bit high,
yeah.
but
Better than it was.
yes. But I raise people's blood pressure anyway. You don't have diabetes.
Nope.
But your father had a heart attack in his 50s.
Yeah, he's 52.
So we consider that early
Mm-hmm.
for someone to have that.
Mm-hmm.
And for you, what that meaning is that as we go through this discussion, your risk is probably a little bit higher than what we're going to talk about.
Okay.
Because of that. You have some extra risk because of what happened to him.
Okay.
The first thing to do is to go over your cholesterol, and
Okay.
your total was 220,
Okay.
okay? And your HDL, which is considered the good cholesterol,
Mhm.
is 50.
Mm-hmm.
And then the bad cholesterol, LDL,
Mhm.
that's the one that causes the problem,
Mm-hmm.
was 160,
Oh my.
okay?
Mm-hmm.
Our LDL cholesterol goes up as we get older,
Mm-hmm.
okay? And you're 58 years
Mm-hmm.
of age. And so what's great is that you've not had any vascular problems,
Mm-hmm.
and we can prevent those.
Oh, okay.
We can prevent certainly 80% of them from happening with appropriate treatments. So that's what I'd like to talk with you about, is what your risk is,
Okay.
and then have a discussion about whether that's important enough for you to want to make a change.
Okay.
So we use the American Heart Association Atherosclerosis Cardiovascular Disease Risk Estimator, which is an app you can download. And they need your age, gender, race, they need your last blood pressure, your cholesterol levels, and then whether you have any of those diseases that we talked about.
Okay.
So, and when I did that, I was able to calculate two numbers. So we'll start with the first one. And the first one is the percentage of people like yourself that would have a stroke or heart attack or die from that within the next 10 years.
Mm-hmm.
Does that make sense, what we're going to look at?
Mm-hmm.
Maybe a little scary to look at, but we think it's a useful way for us to get at least some kind of idea about where you are in that.
Mm-hmm.
So when I calculate your 10-year risk, it is good that you're being treated for the blood pressure. That's helping. You have about a 5% chance a little bit greater than 5%. Maybe it's 6 or 7 with considering your father's illness, of having one of those things happen. So that would be, another way to think of it, that would be, let's say 6 out of 100 people like yourself, we would expect to have one of those 3 things happen in the next 10 years. What does that seem like to you?
Well, knowing my father's risk, it's a little bit scary. You know, I am planning on being around a long time.
Yeah.
I would rather, you know, keep my options open.
Okay, so we'll talk about ways that you can reduce that.
Okay.
And there's a few ways to do that. One is to eat a heart-healthy diet like the Mediterranean diet.
Okay.
And we'll talk about some components of that. And another way is to take a medication to lower your cholesterol.
Okay.
And the two don't replace one another. They actually add together in reducing your risk. They don't do the same thing. They're actually doing different things to lower your risk.
Okay.
So that Mediterranean diet that we talked about is low amounts of red meats and fish or something, skinless chicken, whole grains for your bread, pasta, rice, and cereal.
Okay.
At least half of those we would want them to be whole grains.
Okay.
A handful of nuts, 100 calories worth of almonds or walnuts, lowers the bad cholesterol each day,
Okay.
also lowers cancer risk. And 5 to 8 servings of fruits and vegetables each day.
Good thing I like those.
Yeah, so you're eating pretty close to that.
Pretty close.
Yeah. So that's great news. That means this number may be actually a little bit lower in reality because you're already doing some things about it. So the major thing to decide today is you're not on a cholesterol medication. You are on one for blood pressure. And my question for you is that high enough for you to consider taking a cholesterol medication, which would cut this risk in half within 2 years?
Yeah, it seems like as we get older, we have to get put on medications. I'm not a fan of going on medications, but I'm also not a fan of dying or having a heart attack or a stroke. So I'm open for suggestions. And what about my lifetime risk?
Yeah,
if
we're
I'm
going to talk about
5%
that.
here.
Right. Well, so we also got that calculated, and your lifetime risk is 50%. So that means 1 out of 2 people, or 50 out of 100, it's saying the same thing, would be expected to have one of those things happen by age 80.
So if I were to go do the heart healthy diet, which I'm pretty close to, but and add the medication, I cut my risk down?
Yes, and we see that would fall 50% within a couple years. And the evidence is pretty clear that the sooner you start treatment, the bigger effect this has with the medication.
Should I have started it early?
Well, we didn't have all the information for that. I think this is a good place to start. In that 5%, that's the first place that the American Heart Association says, really it's up to the patient to decide. Once you get to 7.5%, then they're recommending that everybody would have recommended the cholesterol medicine. So I think this is actually really the right time to be looking at this, and a great way to really prevent one of those events from happening.
Yeah, I agree.
Okay.
If I start when my risk is only at 5%, then hopefully my lifetime risk will go down too.
Yes, it does, the same amount,
And
by half.
right, so if I can cut my risk for lifetime at 25%.
I would recommend, I'm happy to prescribe, I would prescribe atorvastatin. Is prescribed as the generic at 20 milligrams.
Okay.
And you take that, I'd like you to take that for the next 4 or 5 weeks, and then go get another cholesterol level, because we can see all the changes going to happen in a few weeks.
Oh, I've heard that there's some problems with thinking on cholesterol lowering medications.
Yeah, that's out on the internet, and there's a fair amount of discussion about that.
Yeah.
It's been addressed very carefully by the top neurologists and cardiologists in the world, really, and they've not been able to find any evidence for that. We see the same level of that confusion happening for people who are on the placebo meds as with taking the statin. So we don't think that that's coming from the statin at all. If you were to notice it, I'm still going to ask you to stop the medicine and see if it gets better.
Okay.
Because we're treating you, we're not treating people in the study.
Okay.
Yeah.
okay. And then you just said I have to get some blood work in about 4 to 6 weeks,
Yeah, and then
kind
have
of
you,
see where it is.
yeah, have you come back and we can discuss it and see
Okay.
how things are. Also make your efforts with the diet to get your diet as positive as it can be.
Yeah,
Because remember, they work together, but doing different things
sure,
to
sure.
help keep your health. Okay?
Okay, very good.
Great.
So just as a reminder, February is Heart Month, and it's really important. The message here is really important to know what your numbers are and get a baseline so that you can see and how you can actually reduce your risk over time. Knowing these numbers, have a conversation with your provider and figure out the best method for you to prevent your cardiovascular risk.